session that you can understand more about cervical cancer and how to prevent it and reduce risk.
Cervical cancer is one of cancers that obviously affect women and can be devastating because it affects the ability for women to reproduce. So it has quite devastating effects for women, and it's one of those cancers that are probably around the 8th or 9th incidence in terms of Western world incidences. So it's certainly a preventable cancer in many parts.
Okay. So can you tell us like the link between sexually transmitted diseases and cervical cancer?
As you probably know, cervical cancer is a cancer that can be largely prevented, and this is through the use of, because of the reduction in human papillomavirus, which is a sexually transmitted virus, and the strains that has been implicated are P16 and P18, which are thought to cause about 70 to 80% of cervical cancers. And so by preventing the infection of P16 and P18, we can reduce the risk of cervical cancer. It tends to occur in older women, so we'll say above 50-year-old women are the peak of the age where we would expect the incidence of cervical cancer to occur.
So what are the measures that we can take to actually detect if we have cervical cancer, or actually to reduce, to prevent cervical cancer?
So ideally we would like to pick up the cervical cancer at an early stage before people have symptoms, and that is called screening. So screening means trying to do a test in a normal population before they've developed symptoms. And symptoms for many women may involve pain or bleeding. So hopefully we would detect people before that stage. And so with the institution of regular pap smears by the government, that is the screening tool to try and detect any precancerous lesions within the cervix, so that if we get rid of these precancerous lesions, hopefully it would not become cancer, frank cancer in the end. So pap smears is certainly a good screening tool, and that complements what we have already with the vaccination program against HPV, P16 and P18. We would generally recommend that people start doing practice as soon as they become sexually active, and that may vary between individuals, but certainly, you know, that would be an individual, decision to make, but the general recommendation is between 16 to 18 years of age. We usually advise people to have pap smears every 2 years. It's available through the general practitioners. Otherwise, the sexual health clinics, primary sexual health clinics will be able to offer that as well.
Okay. Okay. So one of the common myths about HPV is that once you get the HPV vaccine, you do not have to actually get pap tests. So is that true?
No, that's not true. We know that the P16 and P18 vaccine that was probably developed by an Australian here, prevents about 70 to 80% of cases, because there are other viruses that can cause cervical cancer as well. So definitely with the other 20 to 30%, perhaps we'll try and pick up those that are not covered by the vaccine.
Okay. So there's also like a lot of women do not go for Pap test because it's they have an idea that it takes a long time, as well as it causes quite a high amount of discomfort. So can you tell us more about it?
Right. So Pap smears shouldn't really be painful. It does involve an examination with a medical officer, and that involves just taking some scraping of cells from the cervix itself and then looking at it under the microscope. So it may cause a little bit of a discomfort, but no pain should come out of the procedure. And seeing the importance of what it prevents, I think the benefits of it outweighs